This is Crystal Fenn from MedPage Today. I'm here at the American Academy of Neurology meeting in Chicago, where Dr. Tobias Kurth of Brigham and Women's Hospital and Harvard presented a new analysis of the link between migraine frequency and ischemic events.
Now, when you look at the risk of cardiovascular disease overall, in major ischemic cardiovascular disease events, there appear to be a U-shaped, J-shaped association indicating those with low frequency and high frequency with increased risk for major ischemic cardiovascular disease events. However, there was a different emphasis on specific cardiovascular disease events. Those with a high migraine frequency had an increased risk for ischemic stroke, about threefold or so, and those with a low migraine frequency had an increased risk for myocardial infarction, about 1.6-fold increased risk. So on both ends, there was an indication that there was an increased risk, but this increased risk was specific for some cardiovascular disease events. Now, it is important to understand that this is the overall group. Now, if you divide this according to migraine aura, which is another subgroup analysis of this pattern was only apparent for migraineurs with aura. There was no indication that those migraineurs without aura had any increased risk for cardiovascular disease events for any frequency. Now, the group of migraineurs without aura is the biggest group of migraineurs out there. So for most the migraine patient, our findings are not important because this only is limited to the migraineurs with aura. And among the migraineurs with aura, it seems to be only a subgroup which has the increased risk of cardiovascular disease events. So at this point, my interpretation is that the findings suggest potential different biological mechanisms by which migraine with aura may affect ischemic stroke and myocardial infarction. The consequences of our findings is a little bit tricky since it's unclear whether treating migraine frequency using a prophylactic medication will actually decrease the risk of cardiovascular disease events. This can only be indirect evidence from our data since we had no data to actually evaluate this question. So at this point, I hope that other research groups will look further into this question, which specific migraineurs with aura are at increased risk for cardiovascular disease events.
Thank you, Dr. Kurth. I'm Crystal Fenn, MedPage Today.